Hey, Dr. Derek Nielsen here, owner and founder of Kaizen Physical Therapy. Today I want to talk about 2 secrets with pain meds and injections that nobody's telling you. Now first, like I did in the other videos, let's go over what my lawyer tells me I need to say is information in these isn't for personal use or personal guidance. What it is an overarching theme. This is what science has shown us and this is what personal experience has said, but if you have a persistent pain, you really should seek out a healthcare professional for personal guidance. Okay, so when it comes to pain meds injections, somebody that they're not telling you when you go to your doctor and they're saying, hey, let's get an injection, let's get a pain med. These are things they don't talk about. Is one, do they work? Okay, I lied. They do talk about that. They try and say, I think this will work for you. But the other step, the secret number 2, they don't talk about. Okay, so do they work? The short answer is yeah, they do. So pain meds do work, but the problem here is they work short term. They help in the moment. Once you stop taking the pain med, the symptoms are back. So you have to continually take it. And then on top of that, what once worked, so let's say 1 tablet of something worked, a couple months later you have to take 1.5 for it to work the same. So you gradually are increasing the amount of medicine you're taking. So they're not a long-term solution. They're a very short-term solution, but yes, they do work. Okay, injections, do they work? They can work for some. They don't work for all. I see a lot of patients that'll say, I went and got an injection and it worked for 2 months or 3 months, and I went and got another one and it worked for 1 month or 2 months. I went and got another one and it worked for 15 minutes. So, and then they have to stop taking them because it just doesn't work anymore. And so now they're back at square one. They're 6, 7, 8 months later down the road, 3 injections or so, and they're back at square one where they were. They're in pain. They're looking for a solution. But all they've got was short window of relief, and they never got a long-term solution and found out where the real problem is. They're just masking it with an injection or with pain meds. My typical patient wants to stay away from these. So, secret number 2 is the side effects. This is what your doctor doesn't talk about. This right here. They do talk about that, but they don't talk about this, the side effects of these things. So pain meds, typical side effects, everybody probably knows kind of typical side effects. Lethargy, you can have some constipation, vomiting, you don't sleep well, typical things. But outside of that, I want to talk about addiction. So people that start on these can become addicted. And like I said, what 1 tablet used to do, now you have to take 1.5 or 2 tablets to get the same effect, and your body starts to get addicted to these. And when you finally want to come off of them, it's extremely hard. A stat that really drove home to me, and something that I tell some of my patients is, this is how serious it's gotten, is you're statistically speaking, as an individual, you're more likely to die from a car accident or from a drug overdose, an opioid overdose, than you are a car accident. That's how serious it is. And I believe the year was 2010, there was enough pain pill prescriptions in 2010 to medicate everybody in the entire US for a month. That's how many pain prescription pills that were prescribed in 2010. That's insane. So addiction, becoming addicted to these things is extremely prevalent. So that's one of the side effects that I want to keep people away from, because when addiction sets in, it's very, very hard to get rid of. And then the side effects of injections. So there's a couple of different injections you can get. You can get it in the dural injection, epidural injection, which is around the spine, or you can get an injection into the site of the area that's painful. So they've shown, I saw a study that they were talking about epidural injections specifically, and they showed that for every epidural injection given, there was a 21% increase in the risk of spine fracture for every epidural injection given. That's insane. So it gives decrease in bone. You get bone loss from these injections. The other thing that they found was the epidural injections. For every epidural injection given, there was a 6 times decrease in bone density of the hip. So every epidural injection given, you're losing bone. You're losing bone in the hip, you're losing bone in the spine. That increases the chance of fracture. The other thing is you can get, like I said, you can get the injection in the site of pain. So the one study that I recently saw was talking about the knee, and they showed that people that were getting injections into the knee had increased cartilage loss in their knee. So when your doctor says, hey, you're bone on bone, your joint is bone on bone and that's why you're in pain, what they're saying is you don't have any cartilage. And then they go in there and give you an injection when you're bone on bone, and that's been shown to decrease even more cartilage. So I don't know, it's a short-term solution, it's not a long-term solution. They can work, but the side effects really just don't outweigh the risks. I hope that makes sense. I really want to keep my patients away from that. These are the type of things my patients say, hey, they offer me this, but I don't want it. And so they're looking for long-term solutions. All right, again, let me know if you have any questions about anything. You can reply directly to this email. And I look forward to talking to you tomorrow. Thanks so much.